Hello again, everybody. Welcome to another segment of Inspired Voices with Sangwadzi Spiweka Chizamapfumo. Um, I have brought you another guest. I am so looking forward to talking to Dr. Kudzai Dombo, who is my guest today. And the topic that we have today, I think it's right on time in celebrating Mother's Day because the topic is about menopause and perimenopause. And it's a topic that people don't talk about. I mean, people tell you about that you're going to get your period, getting you ready for that. But they don't tell you about menopause. And a lot of people just find themselves in the heat wave and like, what the hell is this? And we don't quite understand it. But I thought today I'll bring somebody who will talk to us about that. Every woman, every mother, every aunt, every young person should listen to this because we need to know these things because there's nothing kosher about it. Now with internet, we read this about these things, but I thought I'll bring a real person. Again, she's an ordinary person, but an absolutely extraordinary woman. I knew her when she was a kid. Now she is she's California based. She's a gynecologist and obstetrician and also focusing on women's health. Welcome to the program, Dr. Dombo.
Thank you, Auntie Spiwe. It's such a pleasure to be here. And I look forward to being able to share a lot about what the things that I've learned myself.
Fantastic. So, like I said in my intro, that this is a topic which a lot of times people don't talk about. In particular in our culture, they don't. You just kind of like run into it, and you just like, I'm ablaze. I have no idea what's going on. But let's talk about who are you? Who is Kudzai Dombo? How did you get into this? And you've got a very interesting background. But talk to me about that.
Yeah. So interestingly enough, so my parents were in the United States for college, and they happened to meet. They got married, and they had 3 children. We were all born. The 3 of us were born here in the United States, and then after independence, Dad was like, "No, it's time. It's time for us to go back home to Zim." And so I was 8 years old when they moved back to Zimbabwe. And I remember thinking to myself at the time, I had my grandmother visit, my grandmothers had visited, but I never really had that opportunity to know what it would be like going to Zimbabwe and living in Zimbabwe. But, it was exciting. And as an 8-year-old, I was open to, whatever that would bring. So I remember, coming to Zimbabwe, not knowing what I'd be expecting, but then loving, the opportunity to grow up in a culture where I just felt very grounded. I felt like family was, it was the extended family. It wasn't just the nuclear family, but it was, growing up with that extended family. So I was in Zim for, great primary school as well as high school. And then when I finished my A levels, that's when I decided to come to the United States. And one of the things that was very inspiring for me, when I was trying to decide, okay, what do I do for my A levels? Going from my O levels to my A levels. And my father is a physician and he was very well respected in Zim. So I remember thinking, he spends so much time, away from home. Is that what I want for myself? And for me, in high school, I remember saying to myself, that is not something that I want for myself. I want to be able to have a family, kids, be able to, share time with them. But, I went to, when I was in high school, I was a part of this organization called Interact. Mm-hmm. And Interact was one where we got a chance to go and volunteer and do activities outside of the school grounds. And I remember visiting a remote village, and being able to see, wow, we were able to raise a little bit of funds, buy books, educational supplies for the women and the children there. And I was like, whoa, as a woman in Zimbabwe, being able to have a voice that would be heard, being able to change policy, being able to direct how things could help women and children, that's something that I saw this is something that was burning in my heart. And I think I was like, getting an education, in medicine would garner me the respect, because I saw how Dad was, it would garner the respect. And then I'd be able to use, my drive and motivation to influence policy. when it came to, just caring for the people that actually needed the care. So that's kind of what fueled me, is being able to see my dad, being able to see just how he cared for his patients. But then also what drove me is that really being able to be a voice for women, and being able to provide, being able to stand in the gap, for women where the voices, weren't.
Yeah. Okay, you were kind of frozen there. Where did you go
Okay.
to high school? Tell us a little bit. Where did you go to
Okay.
high school?
Yeah. So I went to Arundel. So Arundel was known as the Pink Prison. And
Mm-hmm.
so, I think all of us looked at opportunities where we could get out of the, school grounds. And I think initially when I thought of Interact, I thought, oh, this will help me, be able to do things that are outside. But I didn't really recognize the impact of that community of other girls and what we could do. The small things that it just took a little bit of just raising funds to see and being able to see the impact that it had on communities. That's what was really important. And
That's very interesting, because it's the volunteer work that you were doing, and of course I think that a lot of influence came from your father being a physician, and Dr. Dombo.
yeah,
Everybody knew him, and you came from a family where education was also very important.
yeah,
They went to the States in the 60s, right?
yeah,
60s, yeah, in the 60s. That's when they went to the States. And I remember, because I know your family. I've always known your family, your mom, and uh, that actually is, we can't ignore that, because I think that influenced you. But
yeah.
yeah. So tell me, when you went to the States, when you finally decided you wanted to go to med school, when you did you discuss this with your dad and your mom and dad?
So this is where I say it was so interesting, because dad was always like, medicine is such a good profession. Medicine is such a good profession. And I was very resistant, to doing that at first. And everywhere you'd go, my uncles, oh, you did so well in school, you should be a doctor like your dad. I didn't want to do that. I didn't. I was like, not with that lifestyle. But
Mm-hmm.
it wasn't until but the thing that I think I will always remember, especially the times that he would say, no, I want you guys to be grounded. You need to know where, yeah, you're able to go to good schools. Yes, you're able to do all these different things, but you have to understand where it comes from. It comes from me being able to help, a community. And so he wanted to make sure that we came to the office, we helped him, even if it meant just, okay, can you make sure that you are checking patients in, or, doing certain activities
Mm-hmm.
that made us understand that, this is really, these are the people who are allowing you, yes, it's my skill, but this is where it's coming from. You need to be grounded in that. And that was something that was very important to him. Me, my two sisters, unfortunately, my brother didn't have to go through it, because he just said he would faint at the sight of blood. So, but me and all my sisters, I remember, and we would be like, oh man, we don't want to, it's like, when are we going to have lunch? When are we going to, because he would have like 120 patients sometimes every day. And
Yeah.
he would stay until he saw the very last one, so it was very, just to see the commitment that he had, and it wasn't just commitment to doing a job, it was commitment to the people, the individuals. He
Yes.
wanted to
Yes.
make sure they were well. He wanted to make sure that whatever issue they were having was addressed. So being able to see that example of excellence, um,
Mm-hmm.
for me, I don't rest unless, a patient is taken care of. Even if, it means, okay, you need to come back, you've already paid, like, I'm not, like, I just want to know that you are taken care of. And so that's something that he instilled within me, being able to see that example.
That was good training, Dr. Isaac Dombo. That was good training. And now we have another doctor. But fast forward. Now, let's talk about this fire tomorrow. This
Mhm.
menopause thing. It's
Yeah.
like I said earlier on. It's something that culturally we don't talk about it. When I got into it myself, I had read a lot about it, and And I knew it right from there when I got my first. I just knew that what that was. But it's not everybody.
Yeah.
Talk to us about what is menopause, what happens to the body,
Yeah.
and what is perimenopause, and how does that work in the body of a woman, because this machinery it's got its own life, which we
Yeah.
need to talk about. You
Yeah.
get your period, and then when it stops, go ahead, talk to us about the difference.
Yeah, so I'll just start on spiel by defining these two conditions, right? We have menopause, and that's defined by going 12 months without a period. So the day that you have gone 12 months, it's not 9 months, not 9.5, not even 10 and a half or 11 and a half. It's a full 12 months with no period. That's the definition. And I'll tell you what happens, okay? And perimenopause is considered the time leading up to it. So that can be up to 7 to 10 years before menopause actually hits. And so what tends to happen during perimenopause is that you have these fluctuations of estradiol and progesterone. Normally, you have a normal cycle of estrogen and progesterone, and that's what leads to ovulation and you have a period. So it's a very cyclical pattern. Estrogen peaks in the first 12 days of your cycle, leading to ovulation around day 14. And then after ovulation, your progesterone peaks and then leads to a period. But what tends to happen in perimenopause is that you have these wild fluctuations. So that cyclical, hormonal pattern starts to get thrown off. It just fluctuates. And that fluctuation can lead to irregular periods where you start to notice that, man, either my cycle is getting shorter, my cycle is getting longer, I'm having heavier bleeding, or my bleeding is lasting longer than the normal 5 to 7 days. Then you can also notice during perimenopause the symptoms of menopause, because the dips in estrogen, when the estrogen goes down, it can lead to the typical hot flashes, night sweats. Some women don't even have hot flashes and night sweats. They can start with depression, anxiety, irritability, fatigue, where they feel like they're just exhausted, brain fog, where they just feel like they're not able to think clearly. They lose their memory. They can't remember numbers. They remember, I saw something somewhere. I just don't remember where I saw it. Where did I leave my phone? Like things that they were like, I feel like I'm losing my mind, and
You
this
will
is,
be losing your mind. Are you kidding? With all that heat, it's crazy.
but here's the thing, even with the hot flashes, I've had patients, engineers, the only woman in their firm doing presentations, and all of a sudden, they are drenched in sweat. And it's not like they can run to the restroom, or run to the bathroom and, wipe themselves, because they're in the middle of a presentation and these men don't understand,
Nope.
so then I also have a friend of mine, she's responsible for billion-dollar contracts. Okay. She is a contract negotiator. And she is like, I'm in meetings and I can't remember my words. She's responsible for this kind of thing. So it really can impact women in just feeling like things are off. And on spirit, there are also very atypical symptoms. Like some people will notice a change in their body odor. Okay, that's another thing. You can have really dry eyes to the point where you start to need, medicated eye drops, dry mouth, burning mouth, dental, cavities, because what happens is estrogen is responsible for the bone, the bone density. And so as the estradiol levels fluctuate, like the gap between your teeth and your bone gets impacted, there's painful sex that happens because your vaginal tissue is impacted. Some women start noticing pain, discomfort, frequent urinary tract infections. These are all, they've found at least 100 symptoms that are
I
associated with
believe, I
now.
believe you. I believe you because it is a terrible time. But now, with what you're telling us, these are some of the things we didn't even know, and like the dental issues that you might have due to that, and it's just a myriad of things happening, right?
Yeah,
And
a
I
lot.
think it's important for us to know that, because half the time when we think of menopause, we're just thinking of the hot flashes, which are bad. That is bad stuff. But there is more to it. Go ahead.
So yeah, there's also, okay, so we have the short term, like the immediate, right? The immediate impact, but we're not also looking at the long-term consequences, right, of these hormonal changes. Because menopause, the level of estradiol is very low, which is why you have those symptoms, the estrogen. And so you think about cardiovascular benefit. Estrogen is responsible for really protecting our blood vessels, keeping them very, instead of being rigid like a tube, very, very elastic. So it promotes the elasticity of our blood vessels. And also it's responsible for our bone density. So really maintaining that, matrix of bone density, it's important for. And also, like, when we think about just, our brain health, it's also responsible for maintaining a solid brain health. And, we think about Alzheimer's and dementia. Those are some conditions that can occur as a result of this prolonged decrease in estrogen levels.
And okay, normally it starts at what? Because I know it varies with everybody. Sometimes
Yeah,
it's in the 50s, but sometimes in the 40s. You get it?
So perimenopause can occur as early as 35. We say average age of menopause, we can quote the number for the United States, which is 51. But obviously, every culture, you're going to have to look at culturally based on, diet that they're exposed to, environmental factors. It can be different, right? We say plus or minus 5 years. So it can be as early as 46 or as late as 56, having that last menstrual period. And then there's also premature menopause that can occur. And we sometimes say that if menopause happens before, age 40, before age 40, we say it's called premature ovarian insufficiency. If it happens before age 45, we call it premature menopause. So all these different age ranges to look at, but just because you may notice that you're not having a period and it's gone on for 12 months, it's also, no matter what your age is, it's important to get that checked out. Because again, the long-term consequences of what we call estrogen deprivation, the longer you're exposed to less estrogen, you're looking at significant cardiac concerns, brain concerns. So it's really important, if you're like 40 years old and you're thinking you're going through early menopause, to make sure that you're checked for that. And what are some things that we can put in place to help you?
Okay, because there's some people who don't want to take the therapy, right? What are the challenges there, and the dangers
Yeah.
of taking it, or the benefits of taking?
Yeah. So I think it's really important to, when you're looking at whether or not you are considering hormone therapy, whether or not it's something, you got to look at all the different factors. You got to look at your family history. You got to look at your own medical history. We need to know what medications you may be on, because again, you're looking for somebody who's an ideal candidate, if you are going to talk about going on hormones. And a lot of times looking at bioidentical hormones versus the synthetic hormones, it's also important to delineate the two. Bioidentical hormones are hormones that are structurally the same as what your ovary naturally produces. So what the goal is just to replace what your ovary would not be naturally producing. It's not trying to put you on high doses. It's not trying to put you on something that's going to cause many side effects. It's really just looking at what can we do to replace that, because that's the safest form. And then you have like pills versus, transdermal. That is something that is absorbed through the skin. That makes it even safer. So I think there's been so much information about how to make, if you choose to look at hormones, how this can be a safe option. And then if you choose not to take hormones, let's say that's something that you want to do, you really important to make sure that you're looking at, your cholesterol levels, your blood pressure levels, making sure that you are, eating a nutritious diet. And in general, in Zim, I eat nutritious diet that's, high in protein and also high in fiber, because you want to make sure that you're, you lose muscle mass, as you enter menopause, estrogen goes down. So then also doing, exercise, resistance exercise, where you're making sure that you are assessing your bones. And then you can also look at some of the other supplements, that are important in really reducing inflammation in your body. Supplements, if sleep disturbances are a big issue for you, there's certain, supplements that have been found to really help with that, like magnesium glycinate is one of the supplements that has been helped to help you sleep if that is one of the symptoms that you have as a result of menopause or perimenopause.
I'm going to ask you something. I
Yeah,
know there's quite a big movement of people who really don't believe in, hormone replacement, these therapies, and
yeah,
would like to go traditional. What do
yeah,
you know about some? Because I mean, our great grandmothers, they had menopause, they had
yeah,
the hot flashes, they had all that stuff. How did they manage without having to take all these pills and
yeah.
things?
No, so interesting because I actually went to Cambodia last year, and I go to do these overseas volunteer work. So I was in Cambodia for, I think it was 3 weeks. And one of the things that I did try to find out is how do the Cambodians, manage their symptoms, when they experience the hot flashes. And apparently within their culture, they increase like the beans, a lot of beans, because beans, like soybeans. So soybeans, that can be converted to phytoestrogens. And so there was one study that I found that showed that if you eat 1 cup of soybeans a day, that can really reduce the hot flashes. Making sure that you're still incorporating, all the vegetables. I think we're very good in Zen, when it comes to the
Yeah.
vegetable. Murio, spinach, all those green vegetables are very important for fiber and also to help with just mitigating some of the symptoms. But one of the things that they did, which was really interesting, because I think when it comes to vaginal dryness, right, what they did was crush birth control pills and, put it in gel and apply it within the vagina. And that was something that helped them mitigate those symptoms. But then they also used the moringa tree. They
Yes, yes, I was going to say.
used the leaves, from the moringa tree to make a tea to also help with mitigate those symptoms. So it's interesting because I know in Zimbabwe there's also the moringa as well.
Yes, yes.
One thing that I think, I did a bit of research on that, and that's one thing that you can look at to see, oh man, is this going to be helpful for me? Because every person is different. Every person
Yes.
is different in what may mitigate symptoms for them. So I think it's
And
just,
moringa, it looks like moringa has been recommended for a whole lot of other things,
yes,
yeah, some health issues to take it as part of your
yes.
diet. Yeah. Hmm.
Yes, yeah. So that's why I think it's important. I think one of the things that we have in Zim is soybeans. It's a really great source of protein, fiber, and phytoestrogens to help with some of the symptoms that come along with, menopause. And then, moringa, incorporating that in form of a tea is another option. And then just, I think it's really the sense of community also is very important when it comes to dealing with these things, these symptoms, making sure that you
Because
have a solid community.
I know, and also to know that you're not alone. And I'm
Yeah,
telling you, sometimes it's like a couple of years and it goes, and
yeah,
sometimes no, it will go on, and the hot flashes, and sometimes you don't have all these like people getting to depression and
yeah,
just moody and what. Sometimes you don't even get that. You just wait until you sleep, and it's just like, oh my God, until when? So I mean, it's good that we're talking about these. People have an idea of what it's like, because coming it will. If you're a woman, it will
yeah,
come, and
yeah.
and it might be a short period, but long. It might be a longer period, but it's good it's great to talk about that. So tell me, what else are you doing? You do
What
have
else
a
am I doing?
clinic, yeah, right now,
So,
about
yeah.
health.
So what right now, what
Women,
I'm
is it women of color or just
so, so okay, so I'm the director of advocacy and outreach for Alloy Women's Health. And within that role, what I'm doing is looking at how do we reach Black women, not only to provide them with the appropriate education and resources, but also to empower them so that even when they go to see their doctors, they are not dismissed or ignored or told, oh, it's all in your head. They know how to go equipped to manage the health system. And then we also are like, if you're facing a lot of resistance, within your health system, we're a platform that also allows for you to come and get consults from, menopause experts, as well as, opportunity for any any products that may be of benefit to you. So I'm doing a lot of work reaching out to Black communities. I do, I do speaking engagements, where I just speak about this topic. I, look for places where Black women are already gathered. For example, the first African Methodist Episcopal Church here in Los Angeles, I went and did a workshop for them, just on let's talk perimenopause, menopause, and oh, there we go.
Yes,
And
yes, yes.
okay, we're there. So I'm actively engaging with different communities of Black women to see how we can bring this conversation, empower women, and also allow them to know that there are solutions, and either they can go and speak with their specific doctors, or they can also come to us. And then I also have my own private practice.
You make me so proud, Dr. Kudzai Dombo. You make me really proud because you're just occupying that space, and doing stuff for your communities and making a difference, That's wonderful. I mean, you really truly make me, and I know a whole lot of people who are listening, very proud of young women who are doing things, who are moving the bar, who really are.
On Spirit, this goes back to interact.
True. Yeah, that's where you started. That's where
and being able to see the example of my dad, and how much he deeply cared for his patients. We would hear all that. We would hear the, no, I have to do this. I have to, he was very, very committed, to his patients. And so just being able to see his example, and then also, deciding, at a young age that this was something that, aligns with, just what I wish to do for women. It feels great to be in this place.
Is one of your sisters a doctor as well?
So yeah, my youngest sister is a doctor. She is a rheumatology. She's in a fellowship doing rheumatology right now. So yeah. And then my other sister is a physical therapist.
The whole family is doctors, people.
Not my brother.
Well, I know, not your brother. He's into his own things, Yeah. But I mean, you would have thought people would think, oh, Dr. Dombo's son is also a doctor. But his sisters are doctors, but he is not into that.
That 100%.
But he enjoys what he does. I mean, he's doing what he does.
He's doing what he wants to do. He's doing him.
Yeah, he's doing him for sure. Yeah, that is just amazing. Can you believe it's nearly half an hour we're talking, and it's almost that we just started. And that's what I always tell my guests, that when they say, oh, what are we going to talk about, we don't want to go beyond 30 minutes. And right now it's 28 minutes. We've been talking to Dr. Dombo about menopause, perimenopause, what we need to do, how to understand this whole process, because we all go through it. And I would like to thank you so much for taking your time. I know I've been trying to get hold of you, but you are so busy, But today we managed.
We made it happen. We made it happen.
We did. Yeah, and for me, it's quite early in the morning, and I know you. Either you're at your office is there, or you're giving speeches, or you're educating your communities. But thank you so much for this very empowering and enlightening conversation on what every woman needs to know, because it's gonna come, baby. It's gonna come. That's for sure.
If you live long enough, you will experience it.
You will. That's right. But you see now, like the thing, because people are starting quite early, perimenopause. When you're 30, you're just starting your life, and that's just the beginning. By the time you're 40, 45, it's all there, right?
Yeah.
Thank you so much, Dr. Dombo, for talking to us today. And for those who are following, please subscribe, push your subscribe button, and keep following us. I'll bring you more people, ordinary people who are doing extraordinary work in our communities. And these are women who are raising the bar. Last week we had another woman doctor, and fantastic. I thank you so much for the work that you're doing. And for everybody, we'll see you again next week. We'll bring another guest to talk to us about a different topic. And you have a fantastic evening. From me, Sangwadzi Spiwaka Chidzama Pfumo, and Dr. Dombo, you have a wonderful day.